A hearty good afternoon and welcome to the session on egg freezing and ART guidelines. We are glad to have Dr. Malti Madhu among us today to help us understand the topic. She will take us through that and more in this session today. Doctor, you have the stage.
Thank you. Good afternoon, all. This is Dr. Malti this side. Today's topic for FB Live is oocyte freezing or oocyte cryopreservation, and then a little bit about the new ART guideline. The egg freezing or oocyte cryopreservation. Uh, what is oocyte cryopreservation or egg freezing? Oocyte cryopreservation or egg freezing means taking out the eggs of a woman from her ovaries, then cryofreezing or freezing the oocytes at sub-zero temperature, that is at minus 196 degree temperature for say a period of time, and then thawing the eggs, mixing it with the sperm, making embryos, and then transfer of the embryos, resultant embryos inside the woman's womb. What is this all about? Why there is need for oocyte cryofreezing? Uh, the oocyte cryofreezing or the oocyte freezing can be because of various reasons. First is the medical condition. There are some medical condition when uh, there is premature ovarian failure, means the number of eggs inside the woman's ovary are less in number, and they will go on uh, decline further with the aging. So, in cases of premature ovarian failure, oocyte cryopreservation is indicated if the woman has she doesn't have any baby. Then there are endometriosis or chocolate cyst of ovaries. In this condition, or chocolate cyst of ovaries, there are cysts inside the ovaries that may damage the oocytes with time. So, in these conditions, these women having bilateral endometriotic cyst or chocolate cyst can be a candidate for oocyte freezing. Then take say example of any woman who is in her 30s and she has not found her right partner for marriage, or she has to continue her education, or because of some commitment at her job, she is not right now ready for marriage or childbearing. And at the same time, she is worried that the quality and the number of eggs can decline with age. As we all know that the number of eggs inside the women's ovaries are fixed at the time of birth. And with each cycle, these eggs number and quality decreases. So many years before actual menopause, say after 35 years or even 30, 36, 37 years, the number of eggs that are remaining inside the ovaries uh, diminish in number, as well as their quality is deteriorated. So these are the women who are advised to go for egg freezing. So the candidates for egg freezing are women who are suffering from ovarian cyst or premature ovarian failure, or any young woman who is in her early 30s or even 35 years of age and still not ready for childbearing. So they can go for egg freezing. Another condition is medical conditions. Like other medical indication for egg freezing is the young women who have not completed their families, but they are diagnosed with some cancer. Like nowadays, about 10% of the cancer are diagnosed in women who are in reproductive age group. So, for cancer therapy, there is a need for pelvic radiation or chemotherapy sometimes. This type of cancer treatment can be detrimental to the oocyte quality. These can diminish the fertility of the women. So before going for actual cancer treatment, if they have time for 2 weeks, they can go for their oocyte freezing. So these are the reason why oocyte freezing becomes important. Then uh, also, with age, especially after 35 years of age, there are more number of eggs that has abnormal number of chromosomes. See, an embryo gets its chromosomal makeup half from the sperm and half from the eggs. So there are evidence that after the age of 35 years, the women produces more eggs that have abnormal number of chromosomes, so that can be transmitted to the babies, and that may be the reason for miscarriage. So it is often seen that the women after 35 years of age have higher miscarriage rate. So if they have frozen their eggs at younger age and using those eggs that they have frozen in their 30s, at even 35 or 40 years of age, they have less miscarriage rate. So these are the benefits of egg freezing. Now, how egg freezing is done? So, cryopreservation, oocyte cryopreservation is a process where women's oocyte are extracted, thawed, and stored for later use. When women is ready to bear child after years, then the frozen eggs can be thawed, they can be fertilized and transferred to her uterus in the form of embryos. So, So in recent years, past 10 years, there has been uh, increase in the number of women those are opting for egg freezing. So how egg freezing is done? Let us talk a bit about the history of egg freezing. Human eggs are the largest cells of human body and that have high uh, water content. So whenever earlier in 1986, around in the late 1980s, there was an attempt to freeze the egg. And during the process of freezing, due to high water content, there was some damage in the membrane of egg. So later came the concept of vitrification or rapid egg freezing. So this is the latest technique. Vitrification is the latest technique that is used for egg or embryo freezing. In this, there is rapid cooling of the eggs at sub-zero temperature at 196 degree, and then they are like they are frozen like ice crystals, and there is less damage to the eggs. So whenever on later occasion the eggs are thawed, then there is less damage to the eggs. Mm. So, how this process is conducted, the process of egg freezing is conducted, and what is the prerequisites? And there are some blood tests, like first of all, the women general health examination is done, like a complete hemogram, then kidney function test, liver function test, and also AMH. Anti-Mullerian hormone or AMH is a blood test that gives us idea about the current ovarian reserve. Ovarian reserve means how many eggs she has inside the ovaries. Then the process of ovarian stimulation is started. We try to get mature eggs, as many as we can get in a cycle. So the process is started on second day or third day of cycle. The woman reports in the fertility clinic, and then on the second or third day of cycle, when baseline ultrasound is done, some blood tests, baseline blood tests are done, and then injections are started. The injections are gonadotropin injections that are given continuously for 9 or 10 days. And the monitoring of cycle is done with the help of blood tests as well as periodic ultrasound or follicular scans, in which we try to monitor that how many follicles are developing in each of the ovaries. Then once the follicle size is mature, then the oocyte pickup or oocyte retrieval is planned. The process of oocyte retrieval is done under transvaginal ultrasound guidance with the help of very thin needle that is passed through vaginal wall into the follicles, and then follicular fluid is aspirated. The process hardly takes 10 to 15 minutes, and it is done under anesthesia, under GA, so that the women doesn't feel any pain. Then, after the process of oocyte retrieval, all the follicular fluid is handed over to the lab person who screens the follicular fluid for healthy oocytes, and then oocytes or eggs are frozen on the same day with the process of vitrification. The woman is observed for 1 to 2 hours in the IVF center, and then she is discharged. This is essentially a daycare procedure, and then there is no incision involved. There is no cut over the body, or there is no need for stitch. Then she can join her duties in from next day. In some cases of polycystic ovary, where the number of eggs are too much, like more than 20 oocytes are retrieved, in those cases, she might need 1 or 2 days rest after the oocyte retrieval, and then she can join back. So it takes around 15 day of your cycle, about 15 day total treatment. Duration is about 15 day or 2 weeks starting from the second or third day of your cycle. Then later on, whenever she plans to have a baby, it is not essentially needed that she has her baby through IVF only. She can try naturally for some cycles, say 2 to 3 cycles, depending upon her and her partner's age. And then, if she doesn't conceive, then she has to report back to the fertility center. Then her partner's semen sample is taken, and eggs are thawed back, and embryos are made, and then those embryos are transferred inside the womb of the women, and the lining of the uterus is prepared with the help of oral medications. So the process of oocyte freezing or cryopreservation is a sort of so it gives freedom to the women whenever to have to control. It gives more control to the women over their own life. They can freeze if they are not ready for childbearing in their 30s. They can go for egg freezing, and later on those eggs can be used uh, to make embryos, and then that embryos can be transferred inside her womb. That's I think that's all in a nutshell about the process of oocyte cryopreservation or oocyte freezing. We can take questions at the end of session if there are any. So a little bit about ART guideline. The ART guideline, new ART Act that has been passed in January 2021. It has many points. We are going to discuss the main important points that are going to affect the couples who are struggling with infertility in some way, direct or indirect way. So, first of all, the law is passed because um, there should be more control over the IVF center. They should be regulated by some national and state ART board. So the formation of national and state ART board is done after the ART Act was passed. Then there was mainly the changes in the donor cycles. So for donors, uh, the sperm donors as well as egg donors, there will be one recipient only. So you cannot divide the donor's egg between more than one recipient couples. It one donor is assigned to one recipient couple or commissioning couple, and then all the eggs are for use for one couple only. Then The age of donor should be around egg donor, it is around 21 years to 35 years of age. Now it's not necessary that the donor should be anonymous, it can be somebody from your family. uh, she can be your egg donor, but the age should be around 21 to 35 years of age. She should be married, preferably, and then uh, she should have at least one child of at least 3 years of age. Then there is provision of very important point, the donor should be altruistic, that there should be no money involved in this process. You cannot pay somebody to donate you eggs. The donor should be registered with the donor agency, and then she is allowed to donate her eggs only once in her lifetime. Then then there is provision of medical insurance for the donor for 1 year. So that is very important and good thing, that if some complications arises because of the process of egg donation or egg retrieval, then their health is insured. Then for sperm donors, the age limit is around 21 years to 55 years. They can donate only once, and obviously they should be screened for all the communicable diseases. And one more thing that is left, that only 7 oocytes can be taken from the egg donor. Then what about surrogacy? For surrogacy, it is clearly it is very clear. It is very clear now that for surrogacy, uh, the there should be some medical indication. First of all, it's not that you don't want to carry pregnancy and you opt for surrogacy. You There should be some medical reason, either the uterus should be absent because of some complication, or there are some congenital condition where the uterus is entirely absent from the birth. So, or the uterus should be, I mean, it should be in such a condition that it cannot carry pregnancy up to term. So these are some medical conditions that should be there, medical indication for surrogacy. Then the couple, whoever are in the need for surrogacy, they have to uh, go to the council first, and then when in the council their papers are checked that whether they are eligible for surrogacy or not, then they go to magistrate, and then magistrate assigns one certificate for them, that is uh, given to the couple, that they are eligible for surrogacy. Then they have to report to those IVF center that have license for surrogacy. All IVF center which don't have license for surrogacy, they cannot practice surrogacy. So they have to report to those centers that have license for surrogacy. Another thing is that commercial surrogacy is totally banned now. So the surrogate should be altruistic. It should be somebody who is doing that to help the couple. Obviously, the um, uh, medical insurance that the commissioning couple have to insure for surrogate also, but there should not be any money involved. So I think this is all in a nutshell about the important points of the ART Act, that is the latest ART Act. If you have any questions, please let me know. I'll answer them one by one. I'm waiting for any questions. If there are any, let me know. Okay. Thank you.